I've been doing a series on the metal element, which encompasses the lung and large intestine, and it's related to the season of autumn, hence the timing of it. And so we've talked about a little bit about the elements in general, 5 of them, and a little bit about the metal element in particular. And today we're going to talk about the lung and the functions of the lung in Chinese medicine. So some similarities and differences between the lung and the Chinese medicine lung and the Western medicine lungs. And so if you haven't seen the other videos, you can check those out in Wu Healing group or on Dr. Wu Healing, the YouTube channel. So the functions of the lung are to govern qi and respiration, to control the channels and the blood vessels, to control the dispersing and the descending of qi, to regulate the water passages or the dispersing and descending of body fluids. So in addition to the dispersing and descending of qi, and to control the skin and the body hair. And every yin organ has a sensory orifice that it opens into. So for the lungs, it's the nose. So the lung, that's another function, is it opens into the nose. And then every yin organ also has a spirit that it houses. So we talked a little bit about the spirit of the metal element. And so that's the final function of the lung, is that it houses the Po, which is translated as the corporal spirit. So we'll talk a little bit about what all that means. So there's a lot that the lung does, a lot that it's responsible for. And as with any organ in Chinese medicine or meridian, it works in conjunction with others to perform its functions. But to just hone in on the lung, go back to that first function, governing qi and respiration. So there are many different kinds of qi from a Chinese medicine standpoint. And so the lungs are obviously receiving air, so it's called pure qi that it's extracting from the air that the lung breathes in. And so this combines with gu qi, or the grain or food qi that we get from eating, and this forms zong qi, or gathering qi. That's it gathers in the middle dantian area, or more particularly Ren 17, or conception vessel 17, the point on the renmai that runs through the midline of the body. This point is kind of right in the center of the chest, and it's actually called Sea of Qi. So this is a really good point for helping out, supporting the lungs and the upper jiao, or the upper body in general. If this is imbalanced, if the lung is imbalanced, and in particular this function is out of balance, manifestation of it would be a weakness in this area, so resulting in things like shortness of breath or difficulty breathing. That obviously would lead to some kind of fatigue. It could also have an impact on the heart and cause perhaps palpitations, pounding of the heart, as well as a weak voice. So we've talked about how strong lung qi helps to give us a strong voice, and vice versa. So weak lung qi can result in a kind of quieter voice, softer voice, or someone who doesn't have a lot of breath to sustain their voice. So a strong lung qi, strong, steady voice. And some people with weak lung qi just may not even want to speak much because they don't have the qi for it. So that's kind of an idea about the function of governing qi and respiration. So moving on to the lungs' role in controlling the blood vessels and channels. So the heart, there's a little difference in like phrasing that's kind of important with the heart. A heart function is governing the blood vessels, whereas the lung controls the blood vessels. So more so in control of like the movement within the blood vessels, and in particular the circulation of both the shui or the blood as well as the yin qi, or what's translated as nutritive qi. So another kind of qi closely associated with the blood, and so moving those substances and nutrients through the blood vessels. So strong lung qi can actually contribute to good circulation. There's other organs that play a role in this, but that could be an imbalance in the lung could result in like feeling cold all the time, or cold extremities, especially the hands, so more of the upper body when it comes to the lung. And so as well as could result in like dryness or discoloration from a lack of blood circulation. And let's see, the next function of the lung is to control the dispersing and the descending of qi. So obviously bringing in air and the qi from the air, as we talked about, and then we want to move that qi down and into the body to make use of it. So if there's a reversal of the flow of qi, could result in cough, or when it comes to the lungs, that would be cough would be the what's called qi rebellion, or the flow of qi going opposite to what it's supposed to be. So another big thing with this function is it relates to the wei qi, or the defensive or protective qi. So we've talked about that and how that kind of qi is really dependent on the health of the lung, or it really has a very close relationship with the lung. So that is, we can think of it like our immune system, but it's this qi that exists kind of on the surface of the body, and it's the first point of interaction between the body and the outside world. So it helps to keep us healthy, protect us from pathogens. So the lungs spread this qi, this wei qi, all over the body, and so that provides us, like I said, you can think of it as a strong immune system. It also regulates the opening and closing of pores. So also not only about what comes in, but also what goes out. So either being able to release pathogens like through sweat, or toxicity, or just heat. So if someone has irregular sweating, whether it's like they just sweat a lot or they sweat spontaneously, that can relate to the health of the lung. So not so much like night sweats or things like that in menopausal people. That's kind of a different thing. But for people who either don't sweat or they sweat spontaneously, that could be more related to the lung. And so we want to be able to sweat when we need to, and to not oversweat and lose too much chi or nutrients. So when the lungs are in balance, we have a healthy immune system, even body temperature, regulation of sweat, opening and closing of pores. If it's imbalanced, this could result in like blockages, like that we associate with colds, like a stuffy nose. It could result in, like we were saying before, with the regulating of the blood vessels. It could result in feeling cold all the time. Also, the lungs play a role in body fluids. So touching on that next function of controlling the water passages or the dispersing and descending of body fluids, it could lead to fluid retention. So particularly edema of the face. So again, the lungs are to do with the upper body. If it's like edema in the lower body, the legs, that's not so much related to the lung. So edema of the face or urinary retention. Also, if your hands swell when you're walking, this could also indicate lung pathology, where we're not sweating we are not sweating properly and instead retaining fluids. So the lungs, they are also said to spread the body fluids to the skin as a fine mist. So again, if there's a blockage of pores and inhibition of sweating, or spontaneous sweating or facial edema, that could relate to a lung, or that would point to a lung pathology. And then the lung, so that's all about dispersing the chi, and then the lung also plays a role in descending chi. So the lungs breathe in the air, and then what we want is for it to root down into the kidneys. So to be able, if you're not able to take a full breath, that it's like there can be something, disconnect between the lung and the kidneys. So the kidneys receive the chi from the lung and roots it. Like I said as well, the lung also descends body fluids. So moving on to the next function of regulating the water passages, the lungs govern the regulation of flow through the waterways. So like I was saying before, they help to provide this moisture to the skin, as well as sending fluid down to the kidneys and the bladder, which then obviously release what needs to be released through urine. So if there's urinary retention or facial edema, could be a disconnect between the lung and the kidney, or the lung not performing that function properly. And then the lung is also said to be in control of the body hair, so be reflected in the health of the body hair. This is also definitely related to the health of the blood. Like we said, healthy lung results in healthy skin that's good amount of moisture, and warm, and pores that open and close appropriately. So if you have lackluster, rough, or dry skin, or dry, dull body hair, it's said that that could be a pathology of, or a result of a pathology of the lung. Moving on to the function of opening into the nose. So kind of relating back to the lung and its role with Wei Qi, or the immune system, right? We tend to get nasal symptoms are a big indicator of, being sick with some kind of external pathogen, cold or flu. So we get runny nose, or stuffed nose, or sneezing a lot. So that can be an indication, right, that something is usually more of an acute thing that is harming the lung, or the lung is contending with. And also a loss of the sense of smell. And finally, the lungs function to house the Po, or the corporal spirit. So the Po is the most physical and material part of our spirit. So as I said earlier, there's 5 parts. The spirit is divided into, or and each one relates to a different element's yin organ. So with the Po, it's kind of the I think of it like our primal essence, our animal grace, our proprioception, the ability to know where your body is in space, and your sensory experience. And so that imbalance would look like I said, just being graceful, coordinated, having good physical sensations, and on a kind of more spiritual level, or more spiritual level, feeling a connection to spirituality, and connected to a higher purpose, able to feel complete, acknowledged, recognized, respected, and able to experience emotion without dwelling on the experience. So an out of balance could result in just kind of being clumsy, not being aware of where your body is in space, maybe feeling kind of restless, although that I think relates more to our blood, abundance or lack thereof of our blood. Or feeling dull, uninspired, kind of withdrawn, perhaps feeling unacknowledged or disrespected or undeserving of acknowledgement, perhaps seeming aloof and just kind of withdrawing oneself as a form of protection or preservation of what little chi you may have, or constantly looking for inspiration and jumping from one thing to another. So that the metal element has a lot to do with inspiration. So the lungs are said to receive inspiration from the divine, and to be our kind of connection to the divine. And so healthy metal means feeling connected to that inspiration and to the spirit realm. We can become overly sensitive in that way as well, and kind of become a little bit too ethereal, and kind of lose that po, that like earthly, grounded, primal spirit. We can also become very thin-skinned if our lung is imbalanced, so feeling like you are very sensitive to criticism, you can't handle it, don't have that kind of wei qi on an emotional level to buffer you from other people's opinions or perceived opinions. So there's a lot going on with the lung. So we'll leave it at that, and next time we'll talk about some functions of the large intestine, which are relatively few by comparison.